Welcome back, everyone. Today is our first 2020-21 video update, and it's hard to believe that we're already talking about back to school. I hope you've had a good summer. I hope your families enjoyed their summer off and been able to stay safe. And I know this is going to be a different type of school year this year, and today we'll talk for a few minutes about some of the updates that we have for you, and then later in the week we'll have information being sent out by the district as far as more general guidelines and things that will be happening in the fall. And then over the next few weeks, we'll have more detailed information that will be sent out. So starting this week, you'll have lots of information coming from the district. At the district level, some of the things that we're sending out will be more generalized, and that'll be where if you have specific questions, your building level principal or the counselors at the buildings can help you with more of the fine details as far as the things that we're talking about. But just to give you a broad overview, there's been a lot of planning going on with different groups and lots of feedback this summer. And for those of you that gave us feedback during the March through May period as far as how we were doing with virtual learning, that was very beneficial. We've had a great seated summer school with between 1,800 and 1,900 students, and that's kind of our foundation as far as going into the fall, the protocols that we put in place for that. And we're excited to have all the children that attended to be role models in the fall for the other children that will be going to school in the fall. We are monitoring our cases. There is a significant uptick in our case count in Christian County and in our Springfield metro area, and we'll be monitoring over the next few weeks. And the plans that we have flexibility built in where we can, if we need to lighten up, if we need to go firmer in areas, we can. But our core foundation as far as what do you to expect in the fall as a parent? Well, the vast majority of parents, when we surveyed, said they'd like to have seated school. And that's what we're prepared to offer for everyone that would like to attend, is to start off with seated school 5 days a week in Nixa Public Schools. We will have some enhanced safety measures that I'll talk about in a few minutes that are being put in place by the district to hopefully help keep us all safe and minimize the risk of seated school. At the same time, several people have elected for the virtual school, and we'd like to have virtual learning. And we have, I think, a plan in place for virtual learning that if you would like to have that environment, you'll be pleased with what you hear. And I know you'll have questions, but I think we've done a good job as a team as far as trying to reduce the risk for virtual learning, because there's risk in anything that you choose right now. If on the virtual side, will you actually be able to have a year's worth of growth and learning for a year's worth of time, and the social emotional side without having quite the pure interaction. But as far as a core game plan for the fall, we anticipate that there will be times, just being very transparent with parents. I don't believe there's a checkoff where I want my child to go to school 5 days a week, and I can honestly say that your child will be guaranteed to be able to go to school 5 days a week. It appears there's going to be cycles with COVID where there will be times where when the cases increase, we may end up having to literally shut a building down or have a classroom of children quarantined for a couple weeks. As a parent, we need for you to be prepared. Your child may be doing everything properly, but someone sitting next to them may have COVID-19, and then the health department calls you one day and says, for the next 2 weeks, your child needs to be quarantined. And that's going to happen this year. We'll have people to have COVID in our district. Our biggest goal is to make sure that we're able to have school and not have to shut back down and go to a virtual model. And we believe the safety measures that we have in place will help us. Now, as far as enhanced safety protocols, you've probably heard about a few of the things that we're doing, but just to give you a few examples, we have upgraded and added multiple water fountains across our district that have water bottle refillers on them. We have painted our restrooms with an antibacterial paint that will help to kill all the bacteria, or 98% of the bacteria, for 4 years. We have also upgraded our hand sanitizers, and we'll have hand sanitizers in all of our classrooms, multiple locations around the campuses, and even on our buses. And we'll be asking our kiddos to use hand sanitizers multiple times a day. So, like when you're going to class, when you're coming back from specials, when you're going to recess, when you're coming back from recess, when you're going to eat, the restrooms, the buses. So every child will probably be using hand sanitizers at least 8 to 10, if not 12 times or more per day. And we feel like with the research we've put into play on the hand sanitizers, that's going to help tremendously. We've also upgraded our air conditioner filters. They're as close to medical grade as we can get. Our systems was simply cannot handle a MERV 13, but we're at a MERV 11 filter rating. So if you're an air conditioner filter pro, The MERV 11 is one of the best on the market, and we have that in our systems to also help with our filtration of our air. And then some of the larger things that you'll hear about. We've researched all of our chemicals. We have the traditional chemicals that we use. We have backpack sprayers. We have foggers. We even have, based on research from some of the COVID units that are out there, where they're able to take one patient out that has COVID and move another patient in a matter of minutes. We have 2 UVC lighting machines that will literally, in 15 minutes in a 500 square feet area, will kill COVID. In 30 minutes in a large classroom, it will kill COVID. So between the UVC lights and then our foggers, we believe we can make sure to keep our buildings safe. And not just for COVID, but we believe when we have the flu season and we have the common cold, the staph infections you have to worry about in your weight rooms and locker rooms, this will help us to have cleaner, safer campuses for all of our children. And then one other thing that we'll be doing this year is we know we're going to have children with COVID, and our goal is to isolate the cases so we can continue to have school, and also so we can do our best to make sure that we're able to keep our teachers safe and our employees safe, because we can't have school without our employees. I mean, they're the ones that are here every day that are teaching, and many of them will have family members that have health issues, or they may have health issues. They may be caring for a sick child or older family members of their parents. So when we look at our game plan, one other thing that we will be asking for us to use at the very beginning, and we can always go stronger if we need to or lighter, but we're calling it masking on the move, where we're asking it when you arrive on our campus that you wear a mask until you get to your destination, which will be your homeroom, your first period class. When the bell rings, we're changing classes, we're asking that we keep our mask on. And then when we go to our classrooms and we're able to socially distance and promote social distancing, and we're at a safe distance from each other, then the mask can come off. And that's going to be a judgment call apart from the classrooms, because in a normal classroom, if we can spread the kids out and get as close to 6 feet as possible, and we know that we're in a safe zone, then they can pull the mask down. Where in some of the classrooms where our kiddos are packed in, you have more like a very popular class at the high school, and there's 29 in a class, we may have to keep our mask on. So some things we'll have to work together on, but we're encouraging the mask on the move, or requiring the mask on the move, because with the contact tracing, it's a lot easier to continue to have school and keep everyone safe if we know that there's one child that has COVID in a room and we have to send 2 or 3 others that are neighbors home, versus the health department calling and saying, Dr. Loden, you haven't been masking, and you've got kids sneezing and coughing in the hallways and contaminating others, and we can't track back to where it started from, and then we have to shut an entire building down because we have too many cases. So the main goal is to do the little things now, because in a short period of time after school starts, we'll look, and it'll be October, and in October we'll have the COVID-19, the common cold, and the flu starting to intermingle, and typically between October and February is when we're going to have our flu season to start and end, and we know these are going to be the months that are going to really challenge us to be able to have our traditional model school. But we're doing our part and put a lot of little things in that we feel like will give us the best chance to have school like our parents have asked for, and then to have flexibility for the parents who like to have the virtual learning. And then working together, I believe we can evolve the hybrid learning. And just knowing that when you look at the optimistic research out there, there are a lot of people that are very smart that are working on vaccines. But it's probably a couple years away, or a couple of school years away, before we'll have a safe vaccine. And it could even be longer. So knowing that right now, in the front of everything is COVID-19, our goal is to put COVID-19 behind us and let it be something that we know we have to guard against, but still to be able to have school and to create unique experiences. There's opportunities now to reimagine education, and when other people may be saying, well, the kids can't work together, well, there's ways with technology and other things where we can still have teamwork. Why can't we still go to the pumpkin patch? Why can't we still have fun activities and reimagine the way we do things, so we can have a new way of learning over the next few years as we go through this together? We're going to make mistakes. We're not going to have all the answers, but the game plan that we have, I think, is a good, solid game plan, and we'll be monitoring as a team over the next few weeks, because our cases are going up, and if we need to adjust our protocols. But I hope you're pleased. There's been a lot of good feedback from parents over the summer and teachers, and I think there's a good, solid game plan in place for the fall, and we'll have flexibility as we need to change and modify as we go. Be talking to you soon.